Hello, I am Morgan Hansen, and I'm a student at Sci-Fair High School and a member of the Science National Honor Society. Today, I researched and studied the topic of detection dogs identifying COVID-19 within ill patients. My research question is, can dogs detect coronavirus? To begin, we ask the question, what is coronavirus? Coronavirus is an infectious disease caused by the severe acute respiratory syndrome coronavirus 2. It greatly affects one's respiratory system, including the nose, upper throat, and lungs. There are many negative side effects of COVID-19, some being fever, chills, cough, pain in the chest, loss of taste or smell, and trouble breathing. If you are feeling or experiencing any of these, please stop watching this video and go get tested. There have been 49,776 deaths in the United States over the last year, and our world as we knew it previously has been flipped greatly. Over the last year, we went through phases of global quarantine, unemployment, and undernourishment. Although we have begun to bounce back in the United States, due to the increase in vaccinations, it has been a rough uphill climb. So let's begin by touching on some history between canines and smells. The first question we ask is, what is a detection dog? Well, a detection canine is a dog that is trained to utilize its senses in order to detect substances such as explosives, illegal drugs, currency, blood, and common contraband electronics. Drug detection dogs surpass the accuracy of any human interaction or manual screening. Professional dog handlers train these canines using toys and treats so that the dogs continue to find their work exciting, challenging, and fun. It takes around 2 to 3 months to train these dogs to pick up certain smells. The first official American bomb dog came into use in the 1940s for the purpose of detecting German mines in North Africa. By 1971, the United States was training these dogs to identify explosives and illegal substances, notably marijuana, heroin, and cocaine. The use of canine dogs also increased greatly within the 1980s as police officers used them to detect drugs within American public schools. The concept soon became popular and widely used as a tool for increased safety and as a drug deterrent on campuses. With this being said, it is important to note that these dogs possess around 300 million receptors in their nose, compared to the typical human that only has 6 million receptors. A dog's smell is additionally around 10,000 to 100,000 times better than that of a human. So let's move into the experiment we are studying within this lecture. Once again, the big question of these labs was, can detection dogs detect COVID-19 within ill patients? The simple answer is yes, but let's dive into some research. Within a lab presented by BMC Infectious Diseases, 8 canines were presented with 1,012 random samples of urine, some with SARS-CoV-2 and some without. These dogs were then given the chance to distinguish between the two and alert when they detected COVID. The dogs were able to discriminate between samples of infected, positive, and non-infected, negative individuals with average diagnostic sensitivity of 82.63% and specificity of 96.35%. During the presentation of 1,012 randomized samples, the dogs achieved an overall average detection rate of 94% with 157 correct indications of positive, 792 correct rejections of negative, and 33 incorrect indications of negative or incorrect rejections of 30 positive sample presentations. Although this lab is a very firm demonstration of this process, another lab also helps to solidify this idea. Another lab performed by the University of Pennsylvania's School of Veterinary Medicine helped to demonstrate that dogs can, in fact, sniff out COVID-19 within urine. In this study, 8 Labrador retrievers, along with 1 Belgian Malinois, worked to detect the presence of coronavirus within urine. To begin, the 9 dogs were trained in general scent detection. After the dogs had mastered this process, they moved on to urine samples. Again, some with COVID and some without. Eventually, within 3 weeks, these dogs provided a 96% accuracy rate for detection of COVID-19. However, there was one slight discrepancy in which a few of the dogs became tripped up by a current COVID infection and a past COVID infection. Nevertheless, this fascinating tool comes to great use in the current times of the world. These labs can help to demonstrate that trained canines can detect respiratory secretion samples from hospitalized and clinically diseased COVID-infected individuals. The current study results are very promising, although they should be regarded as preliminary. Suitability for this detection method in the field can only be acquired after further research has been conducted. The work completed throughout these labs provides the very first steps of the development of a new SARS-CoV-2 screening method, which can be so important in the stopping of the spread of COVID-19 and the return back to a normal life. Furthermore, this new method provides an alternative for certain forms of testing. Additionally, and lastly, it can be useful in lower income countries in which people do not have access to certain forms of testing and healthcare. On this last slide, I put the findings presented and the citations for both of the labs. Thank you for listening to my lecture video.